As you are all aware, the incidence of heart disease is growing in the young. We do not have the complete information as to how this epidemic is striking in our country, but there are very preventable reasons for it. For example, taking care of your cholesterol, taking care of the weight, taking care of the blood pressure and the blood sugars, no smoking. I guess these are the vital points in prevention of heart disease that all youngsters will have to carefully consider and look at. Now, is there a way in which we can pick up whether there is a heart disease in the young? I guess besides the prevention, if one can seek attention on basic blood test or get an EKG done, or in these days we have a technology called as the cardiac CT coronary calcium score, and although it's not recommended in very young, there is the young to middle age where a CT coronary calcium score can identify whether there is a likelihood of heart disease. You may ask, why do youngsters get a heart disease? I guess the most important thing is the lifestyles. The lifestyle modifications will include lowering of sugars, refined sugars in the diet, lowering of the amount of saturated fats we eat, following a good exercise pattern, keeping the stress down, and the most important, of course, one needs an adequate duration of good quality sleep, something that's missing in our younger generation because that's how life is progressing. What really happens in young people who get heart disease, it may not necessarily always be thickening of the heart vessels. Some have clotting inside the circulation, and that can be quite a disastrous thing. The clotting in the coronary artery disease, in the coronary circulation can also be identified once a patient seeks medical attention. I guess we will have to look at why more youngsters are getting heart disease in the country unlike the rest of the globe. And I'm sure there's a lot of medical research going on in our country which focuses specifically on identifying the causes and treatment of coronary artery disease in the young.